So I'll tell you about an interesting patient that I saw today in consultation, Dr. Bob Ganz, board certified gastroenterologist. This is a patient who came to the hospital about a week ago. She's been in the hospital for a week with severe abdominal pain. She presented with severe abdominal pain and very severe protracted nausea and vomiting. She's just starting to get better now. Her pain is better, still has a little nausea and vomiting. And what it turns out she has is a disease called Cannabinoid Hyperemesis Syndrome. And it's from smoking marijuana or ingesting marijuana to excess. So these are heavy users of marijuana, people who've used marijuana for years, 3, 4, 5 years, sometimes longer, and they come in with severe abdominal pain and severe nausea and vomiting, very significant. Cannabinoid means the active ingredient in marijuana. Emesis is the medical term for vomiting. Hyperemesis means you vomit a lot. So Cannabinoid Hyperemesis Syndrome. Very significant disease. Now, back in the day, when I was smoking marijuana as a kid in high school and college, the marijuana that we smoked had only about 1% THC in it. It wasn't very potent. But today's marijuana is much more potent. It's been engineered to have about 95%, up to 95% THC. And that amount of THC taken, smoked, or ingested over many months or years can lead to this syndrome. Now, exactly why people get this syndrome, we don't know. It does seem it's another brain-gut microbiome access syndrome. It tends to mess up the cannabinoid receptors in the gut and brain signaling, and it causes this abdominal pain, nausea, and vomiting. It's very interesting in that hot baths or hot showers tend to make people better. So one of the ways we diagnose this is people come in, they're heavy marijuana users, and we say, do you feel better when you take a hot bath or hot shower? Invariably they say yes, and that tips us off. There's something about marijuana at this level of potency that affects thermoregulation, either in the hypothalamus, or affects capsaicin receptors, and taking a hot shower or hot bath tends to ameliorate the symptoms. People feel better, so they do it. So it's a good tip-off to us. The diagnosis is one of exclusion. We just exclude everything else. We take a good history. It turns out people are heavy marijuana users. This hot bath shower thing is a good clue for us that this is what it is. The only solution is to stop marijuana. If you don't stop marijuana, you're a heavy user and you keep using it, this syndrome will come back over and over and over again. Once you get it, there's no way out other than discontinuing marijuana completely. And people who are addicted to marijuana don't like to hear that. Now, this is a bit of a paradox. It's an interesting paradox for us because we use marijuana to treat nausea and vomiting, particularly in chemotherapy patients at relatively low doses. But at high doses over many years, you get the opposite effect. Instead of helping nausea and vomiting, marijuana causes nausea or vomiting. So super interesting syndrome, Cannabinoid Hyperemesis Syndrome. We're seeing it a lot now. It's relatively new. I didn't see it in the beginning of my career, but with these more potent strains of marijuana that are out there, we're seeing it a lot. It's not a small deal. People really suffer with this. It's really significant, and it's not unusual to have people hospitalized for a week or even more with this. So it's an interesting thing in gastroenterology. Okay, now you're informed. As always, like and follow, ask your questions. I'll try to get to as many as I can, and we'll take on another topic tomorrow. Thank you.